just wait another couple of seconds. Wonderful, wonderful. Well, again, bonjour tout le monde. My name is Linda Barber, and I'm the branch manager of the Ottawa branch of the National Association of Federal Retirees. I'd like to begin by acknowledging that the land on which our office is situated is traditional unceded territory of the Algonquin and Anishinaabe people. On behalf of the branch, I'm pleased to welcome you to today's webinar titled Bone Health 101, What You Need to Know About Your Bone Health, presented by Meg Stickl-Kroeker, owner of local business AIM Fitness. And we'd also like to welcome the guest speaker she's brought from, who's a volunteer with Osteoporosis Canada, Kajina Ravindran. Now, I want to let you know that Meg specializes in fitness for adults over 50, and she's been working in this field for over 15 years. And our branch is proudly in the second year of collaboration with Meg, and she's been offering our members online fitness classes every month. And you can certainly go to our website and sign up for those. Today's webinar with Kajina is going to help you learn how to reduce your risk of fracture and how to understand osteoporosis and its effects, how to maintain healthy bones, the impact of nutrition, the impact of physical activity on your bones, and fall prevention. Veuillez noter que le webinaire sera présenté en anglais, mais la participation bilingue est toujours encouragée. Now, I want to give a special welcome to anybody here who is not yet a member of the association. We hope these webinars will inspire you to join us. And of course, to the folks who are our members, we hope that these webinars will encourage you to maintain your membership. And we want to remind you, as the holiday season approaches, that you can give the gift of membership. If you want to learn more about how to do that, we're going to put a link in the chat box that you can click. I also want to let you know that we're in the middle of our mega recruitment drive. From now until December 31st, every time you recruit successfully a new member, you will receive a ballot to win one of 14 great prizes, including the $10,000 cash prize from Johnson Insurance. All members who successfully recruit a member will also get, per recruitment, a $5 Tim Hortons gift card. And there's no limits on the number of times you can be entered into the grand prize draw. So the more new members you recruit, the more chances you'll have to win, and the more your branch will grow. Now, after today's webinar, Ottawa branch will send you an email with instructions on how to access the recording of today's webinar. We'll send you more information on the mega recruitment drive and also on how to give the gift of membership. And one last reminder, if you didn't invite a guest to this webinar, you certainly can invite other guests to our other webinars. We're hoping that they'll try us out for free. There'll be a question and answer period at the end of the webinar. What we're going to ask you to do is to type your questions into the chat box during the session as they occur to you. And at the end, Meg and Kajina will answer them during the question and answer period. So thank you again for zooming in. And now I'm going to turn the presentation over to Meg and Kajina.
All right, thank you, Linda. And thanks everyone for joining. We have a really good turnout. And I want to just thank Kajina so much for being here on behalf of Osteoporosis Canada. So she has a fabulous presentation for us. And I have to say, osteoporosis and bone health is one of my favorite topics because it connects so well with fall prevention. So if any of you are looking for a way to stay active, prevent falls, many of you know, but you may not know that you get a special 33% discount off my membership. And in the month of October, we are celebrating and focusing on fall prevention and improving balance. So be sure to send me a message if you want to learn more about that. And I want to pass it right over to Kajina so we can get started into today's presentation. So thanks again for being with us here.
Thank you, Linda and Meg. So welcome everyone, and thank you for joining us today for Osteoporosis Canada's webinar, Speaking of Bones. And my name is Kajina, and I am a volunteer with Osteoporosis Canada, and I will be your presenter today. So in this 30 to 40 minute presentation, I will provide some general information about bone basics of osteoporosis, but please note this information is not intended to replace any medical advice, so please consult with your healthcare provider with any individual medical questions you may have. And before we begin, I will be taking questions at the end of the presentation, and if you do have a question, please write them down during the presentation. And also, there is a chat box, so you can feel free to ask questions in the chat box, but I will take a look at it at the end of the presentation if that's okay. So let's begin. So who we are. Our volunteers are from all walks of life and backgrounds. Many of us have a connection to osteoporosis and are pleased to be able to bring this information to groups like you. So just an overview, we're going to start with some bone basics, then a fracture risk assessment, then some medication options, and then move on to nutrition and exercise and movement. And last, we'll be looking at preventing falls and broken bones.
Gina, sorry to interrupt, but I don't think you've shared your screen yet.
Are you not? It says I'm sharing my screen, is it not?
I'm viewing the screen, Meg.
Oh, okay. Oh, there we go. In case anyone can't see it, you might have to change your view.
Sorry, should I?
We're good.
Oh, okay, okay.
My bad, thanks.
No, let me know if anyone else can't see it, if I can do something from my end. But so moving on to some bone basics. So bone is living, growing tissue. So note the similarities. So we like to start off with a kind of a comparison. So you see the bones, this is the bone and this is the bridge. So you can see the bridge support. So the combination of protein framework hardened by two primary minerals, calcium and phosphorus, give us the bone tissue flexibility as well as strength. So this is similar to the bridge right here. And note, so there are two types of bone. The outside right here is a cortical bone, which is a dense, compact outer layer. And the inner layer is a trabecular bone. And this has a structure that's similar to a honeycomb. So outside and then the inside. Sorry, the outside right here and then the inside. So the amount of bone tissue is called bone mass, and density refers to how compact bone structure is. I know this gets confusing, so that's the difference between bone mass and bone density. So how the bone actually remodels itself and repairs. So the cells called osteoclasts right here, they create a cavity on the bone surface. And then the cells that are called osteoblasts right here, they fill in the cavity. And that's how our bone repairs. So osteoclasts actually remove old bone, so it's called bone resorption. And osteoblasts, they lay down proteins and in that form of collagen, and then they harden. And then that's how they kind of build at the cavity. And let me know if you need me to repeat anything or any terms throughout the presentation. Just raise your hand, I'll see it. So how bone mass changes with age. As you can see on this graph right here, your peak bone mass is actually around age 20 to 30. And after age 30, it actually declines throughout the years. And it declines at a faster rate for women because of menopause. And you're at an increased risk after age 50. So right here, if you can see it. So we build peak bone mass around age 20 and around age 30. Osteoclasts do tend to become more active than osteoblasts, and the body does begin to lose bone. So the percentages we're talking about is men and women, they lose about 0.5 to 1% per year after this age. And women do lose a bit more after menopause, so about 2 to 3% per year. And men do lose more slowly, but it's not, you can't tell unless you do a bone density test. We'll get to that. And this is why it's known to be a pediatric disease, because it does show up after your age 50, whereas it is declining throughout the years, but you're not able to feel or experience anything. And bone loss can reach a point where fracture risk increases. So the bone, the more you're losing bones, you are at a heightened risk for fractures. So what is osteoporosis? Osteoporosis is a disease characterized by low bone mass and deterioration of bone tissue, which can lead to increased risk of fracture. And this is not osteoarthritis, I know these two terms get confused, but osteoporosis is more within the bone structure, whereas arthritis is usually between the bones. It's more inflammation. So think of porosis as right inside the bone tissue itself. So right here we have two images. On the left, right here is the normal bone structure. So this is less porous, or we like to have less holes or space between them. And then right here is a bone where they are experiencing osteoporosis. And as you can see, there's more gaps and holes in the bone structure. So this is why fragility or fractures are increased, because there's more space. If you do slip and fall, you see like you can break it with this structure. And this is why it's often referred to as the silent thief, because there's really no symptoms that you feel except the bone inside experiences all these gaps and holes, and they deteriorate. So that's how a fracture occurs. So moving on to the types of osteoporosis. So the primary one that I talked about is associated with menopause and age and unknown causes, whereas the secondary one is related to a disease or a drug therapy. So this is often related to another disease and a drug that's impacting your bones, whereas this one is more of age and menopause and other unknown causes that have occurred. So some diseases for secondary disease include rheumatoid arthritis, lupus, or multiple sclerosis that affect you to get osteoporosis or relate to osteoporosis. And the significant consequence of osteoporosis is increased risk of fracture. So moving on to some common fracture sites. So some common fracture sites are the shoulder, the spine, the hip, and the wrist. And over 80% of fractures after age 50 are caused by osteoporosis. So why these four sites, you may ask? Well, these four sites are more rich in the honeycomb structure we talked about earlier, and the trabecular bone, so the honeycomb structure, is more sensitive to calcium loss with age and menopause. So that makes it more prone to fractures at these sites. So like I said earlier, and I repeated, bone loss actually doesn't hurt, and your first sign of osteoporosis may be often a fracture. So fragility fractures. Fragility fractures are broken bones that happen spontaneously or as a result of normal daily activities or a fall from standing height or less. So fragility fractures are the most serious sign of osteoporosis, and this actually triggers for a bone mineral density test. And a bone mineral density test is often by your healthcare provider, so you should just ask them to get a bone mineral density test. And this is the only way you can actually know if your bones are deteriorating. And wrist fractures are the most common type of fragility fractures in women under 75. So like we talked about earlier, spinal fractures can result in height loss, and height loss, back pain, sleep disturbance, depression, protruding abdomen, digestive disorders, trouble breathing, impaired activities of living. So because your vertebrae kind of collapses, this is called kyphosis. And this is another sign that you have osteoporosis, and it's like a height loss. So this should trigger for a spinal x-ray. So if you notice any like curvature, or you notice like your back is kind of curving a bit, not too much, like you can see a little bit more right here, but even if it's a tiny bit more, you can go and get a spinal x-ray from your healthcare provider, and that would actually let you know if there's, if you're at a more risk for fractures and whatnot. Because if you do have a protruding abdomen, it does affect other things like digestive disorders. So even if you have digestive disorders and you don't notice much of a height loss, then you should also ask about a spinal x-ray. So if you feel comfortable and if you're sitting up, if you can find the bottom of your rib cage at the top of your hip bone, and you should be able to put 3 fingers in this space. I don't know if you can see. And like sitting up, take a deep breath. And now bend slightly forward. Let me know if you don't have space. And you can notice the space actually getting smaller. And if you take a deep breath in now, it might feel a bit more harder to breathe. So because of this like curvature in your back, you might you'll have trouble breathing as well. So it's important to notice that this curvature does impact other things, but it also does point out to osteoporosis. And because 2/3 of spinal fractures are painless, it does often go undetected. So this is a greater way that you can notice, oh, there's a change in your height loss. So you can go and get a spinal x-ray. So like we mentioned, height loss is an early warning sign, and all men and women 50 plus should have their annual height measurements done. So if you're losing maybe more than 3/4 inch in a year, so that's roughly 2 centimeters, or 2.5 inches since young adulthood, this should immediately trigger a spinal x-ray and an assessment for osteoporosis. So hip fractures. 40% of people who have a hip fracture had a prior non-hip fracture, which was not recognized as a warning sign of osteoporosis. So 1 in 3 hip fractures, actually, patients will suffer from another fracture within the same year. And after a spinal fracture, the risk of suffering a second spinal fracture in the following year is actually increased by 20%. And if osteoporosis was identified when the hip wrist was broken, it is very likely that treatment with an effective medication would prevent any further fractures or hip fractures. So the incidence of osteoporotic fractures, like we mentioned, women do lose more bone after the age, after menopause, but osteoporotic and fragility fractures are more common than heart attack, stroke, and breast cancer combined. So as you can see in this image right here on the left, it's 1 in 3 women and 1 in 5 men. So it is more common in women than men, but men actually suffer more complications than women do following a hip fracture. So this is because men with osteoporosis are often underreported and underdiagnosed, and because they're undetected, they often go untreated. And fewer than 10% of men with fragility fractures actually receive therapy. And over 1/4 of hip fractures in Canada do occur in men. And because it does go undetected, they're more likely to die of complications. So it's important to notice, I know it's like you don't feel anything, but any kind of changes with your, if you did have like a fracture before, or even if you notice your spine curve, important to get it assessed earlier, so you do know if you are at risk for osteoporosis, and you can take medication or treatment likewise to prevent any future fractures. So fracture risk assessment, and this is more about who should get a bone mineral density test. So BMD stands for bone mineral density test, and all women and men who are over 65 years old should get a bone mineral density test. And it's actually covered by OHIP. So someone asked me that last time, and I think the first one, if you are at risk, it's covered, and then the following ones are determined by your healthcare provider. So do ask them about how you can get one, and make sure once you do get one and you get your assessment done, they'll let you know if you're at a risk or if you need to get it done on like an annual or biannual basis. So it's important to get that done. So make sure you note that down. The next time you do go to your healthcare provider, do ask them about that. And because postmenopausal women and men between 50 and 64 are at a greater risk, it's important, even though it's more recommended for 65, that even if you do notice some of these curving and early on in your age to get a bone mineral density test done. So younger women and men are under the age of 50 are associated with low bone mass and bone loss. They should also get it as well. So if you notice these symptoms or these signs, more say, it's important to get it done as well, especially because I'm going to talk about nutrition. If we know that certain, that you are lower in certain vitamins and minerals, it's important that you kind of check your bone mass over time. So this is like a fracture risk assessment. So I'm not sure how big this is on your screen, but this is a small graph that you show with low risk, moderate risk, and high risk. And the bottom is the age. And as you can see, as you age, so this is like 75, you're at a greater risk. And this risk actually includes like anything with age, sex, and previous fragility fractures. So if you've had fracture previously, then you do fall under high risk or even moderate risk. But if you didn't have one, then you are at a lower risk, especially in your earlier years. But later on, you do fall into a higher risk. So this gives like more of like, this is how they categorize patients who have or come in with osteoporosis, low risk, moderate risk, and high risk. So it's important to know where you fall within these risk categories so you take more preventative measures. So the 10-year fracture risk assessment, so this is based on 2010. I'm not too sure if they've updated it, but this is the clinical practice guidelines. So high fracture risk is you will receive medication and you will repeat BMD every 1 to 3 years. And that's another thing. So if you're at a greater risk, it's important to repeat your bone mineral density test more frequently. But if you're at moderate risk, let's say, or even low risk, they don't do, it's not recommended for you to do it frequently. It's more of you have a greater interval, and those at low at risk do not get any medication at all. So moving on to some medication options. So the overall goals of medication is to reduce fracture risk and prevent further bone loss. So another question I get asked is, are we going to build more bone mass? No, it's just to slow down the deterioration or the breaking down of the bones. So by taking medication, you are stopping it from you're losing at like 0.5% to 1% a year. You're slowing that percent loss, and it increases bone mass, but not to a point where, where you started off with your 20, like at age 20, you were at a peak bone mass. You're not going to essentially build it to that point, but it is going to give you some bone mass that you're able to not have any more fractures. And this is a picture that I brought up earlier with how how it helps. So some medication actually some medication actually slow down the erosion process, and some actually help with speeding the building process. So what medications you would take would depend on your particular issue or like particular case. And this needs to be like best spoken, I guess, with your healthcare provider who will give you further information. So how will you know if the medication is working? To be honest, there is no way to know if it's actually working unless your density is changing, and that can only be seen through a bone mineral density test. And if you do discontinue medication, because I believe you are on it and you have to continue with it, and if you do discontinue it, you are going to continue losing mass. It's not something you'd like, a cold, if you take medication, you get better, you can stop it. No, it's not like that. You do have to continue the medication until, because after a certain age, you are at a greater risk. So it's better to continue the medication going forward. So moving on to my favorite part, it's nutrition. And bone, like I said earlier, is living tissue. So healthy food choices are essential to build and maintain the best bones for the body. So important nutrients: calcium, vitamin D, and protein. And like I said earlier, if you're younger and you're these three, you're getting lower intake, it is important to maybe even assess for a bone mineral density test, even though you're at low risk. Knowing that you're not getting enough of these nutrients may be, you are more prone to fractures later on in your life. So calcium is one key mineral that makes bone hard, and vitamin D ensures that the body can absorb calcium from the gut. So those two do play a critical role. So you need vitamin D to help with the absorption of calcium, and protein helps with maintaining and building collagen, which is really important for us with maintaining and fracture healing. So moving into calcium in a bit more in depth, and calcium has many roles, and it is found in cells, blood, skeleton, and teeth. So the bone is a place where, the body stores calcium, and 99% of the body's calcium is found in our bones and teeth. And only 1% roughly is found in our blood, where it has many life-sustaining functions. So if it's not consumed through the diet, which is, the preferable way to get calcium, then what it does, it draws it from the bone to ensure that the blood levels are maintained in a healthy, safe range. And so the body does regulate the supply of calcium in 3 different ways. So it absorbs it directly from the food we eat. Like I mentioned earlier, it is the best and preferable way to get calcium through food. And then what it does, it slows down the amount of calcium that leaves the body in urine, and sometimes returns it into the bloodstream where it's available to our organs and cells. And third, it takes calcium from our bones if there's not enough available when needed. And you don't want it to be drawn from bones, because that's when you're putting your bones at more of a risk of becoming thinner, and it becomes more fragile, making you, more prone to fractures. So right here we have, if it's not enough, it draws. So we have a chart with the recommended calcium requirement for different age categories, and anyone above age 50 is recommended to have 1,200 milligrams of calcium per day. And if you're not able to get this through this food, then your healthcare provider will recommend something you can, like a supplement you can take, but just make sure that's the daily recommended. So in case you are taking it through food and someday it's like a bit less, that's okay. Just try to, absorb it through food if you can. So Osteoporosis Canada does strongly recommend taking calcium or obtaining calcium from food sources whenever possible. And it is important to eat a well-balanced diet with adequate calcium and protein. But if your diet is not giving you enough calcium, do not take extra supplements, because anything that is too much is not good. So just make sure you're getting calcium. And our website actually has a calcium calculator, so you can put in, the foods you eat and see how much calcium you're actually getting per day. So calcium supplements, so you're supposed to space them out throughout the day to provide bones with a constant source of building material. And it's important to note that whatever supplement you are taking for calcium, that you don't take more than 500 at one time. And it's important to drink a lot of water so it's absorbed well. And calcium carbonate must be taken with food, whereas calcium citrate can be taken on an empty stomach. So those are the two that you have to remember, and I'm sure your healthcare provider will let you know what other things you can follow if you have other medication you take, that what can be taken together and what can't. And it's important to not over-consume calcium from supplements. So moving on to vitamin D, and like I mentioned earlier, it does help to build stronger bones, but vitamin D is essential because it also helps to increase the absorption of calcium. And here living in Canada, we do have very natural sources of vitamin D, like the sun is our main source, but we only get that at least a few months a year, and most of that is now, this summer was all raining. So, we're not getting that a lot. So it's important to take supplements, and it's actually recommended you take it year round after you're 19. And I know we think, oh, we can get it through food, but it's very low amounts in source in food. So after the age of 19, it doesn't matter. As long as you take it year long, there are some recommended intake for men and women over the age of 50. So it's 800 to 2,000 international units. I know it's a huge range, but that range is minimal. So as long as you try to meet at least 1,000, that is good. Vitamin D is limited. So if you are taking it daily, according to how many units you do need, you can take it likewise. And that is all dependent on you. So however much you might need, your doctor may prescribe you likewise. So protein, in addition to calcium and other minerals, bone is also made up of protein, and it is important for bone strength and flexibility, but it also does help with fracture healing and repairing body tissue. So it helps maintain muscle tissue, which is important for mobility as well as prevent falling. So I know it's easier said than done, but to incorporate one protein-rich food at every meal would be very beneficial. So it can be an egg or two, and maybe salmon for lunch, but trying to keep protein for every meal, or even a snack like Greek yogurt and some nuts. Something that's even small, but space it out throughout the day, and trying to have at least one thing per meal is. And say you do miss one, that's no problem, but just try to have it in a snack. I know that's a question I get asked too. Like, what if I miss it? No, it's okay. Like I know some people like to have different things for their meals. So try to have like a protein-rich snack maybe. So nuts, anything that you prefer. It doesn't have to be any of these three pictures. They're just examples. If you are a vegetarian, so like beans, chickpeas, anything you like, try to just incorporate a tiny bit into every meal. And moving on to exercise and movement, and I think Meg can tell us more about it, but I'm just going to give a brief overview. So I know we think that walking is enough. Daily walks are important, but it's also important to do different exercises like strength training, posture training, balance training, and weight bearing aerobics. And when you hear weight bearing, you think of all these, I have to lift weights. No, it can be as simple as a dumbbell. And the importance of these are each help with improving muscle mass and strength, and they also help with fall prevention and reducing risk fractures. So strength training. So this involves using muscles to generate force against resistance, which generally means that you use your own body, or you use another, something to help you, like a dumbbell or even a household object to exercise. So I know during the pandemic, we all started, trying to do exercise at home, but it's important to make sure that your space is actually, clean, and like there's nothing, like it's clutter free, and there's not anything in the way for you to, trip and fall, because that's also another hazard. So with weight training, you can use one exercise for, every major muscle group. It doesn't have to be all. You can do something that maybe works everything all at once. And so maybe smaller dumbbells. What I like to say is resistant bands. I think resistant bands are, you won't drop them and it won't hurt yourself. So resistant bands are really good. So you're working at your arms, and you also, do like more exercises that you don't have to be afraid of, like, you're going to drop the weight or anything. And I know push-ups are good, but maybe modifying that to wall push-ups, because they give you the same impact, and it's easier because you're not putting more pressure on your muscles as well. So start off with just standing wall push-ups that are also good. So moving on to good posture. So there are many exercises that work the back and abdominal areas and shoulders to help maintain good posture. So the importance of good posture is it helps you balance your weight evenly on both sides. And so we're going to try this activity if everyone's okay. So please sit up nice and tall and pretend that you have a string attached to the top and you're pulling on it. Okay? And gently bring, like, so you have to draw it in your spine and gently pull the string and then draw your belly button in towards your spine. So look up. So you keep your gaze up and your head straight and gently tuck in your chin. So you're sitting nice and tall and pretend you're showing off a nice shirt or a nice necklace and you can see your chest right there. How does this feel? Anyone can tell me. How do you feel when you've, straightened your back? Good, right? Yeah, I know I don't do it all the time either, but it's really important to do this. You can do this sitting or standing, but trying to, throughout the day, maybe like as a reminder, every hour to make sure that if you're sitting for too long, that maybe strain it frequently, but it's important to do it throughout the day. And I know sometimes when we're sitting for too long and, we're watching a movie too, we forget, we slouch. I do that a lot too, but this helps with good posture and it also helps with the curvature of your back, your spinal cord as well. So moving on to balance training. So balance training actually helps with improved balance and coordination, which helps to reduce falls and fractures. So it's important to, challenge your balance daily by doing small exercises. It doesn't have to be anything big. You can either find, if you like, a community class, or you can just do it at home. So like you see in this picture right here, she's using a chair and she's just balancing on one leg. And then you can switch over to your next leg. This is just, the importance is to pick one exercise and do it daily. So it doesn't have to be the same exercise every day, but it can be one exercise that you like. It can be like, you can take on dancing or Tai Chi, anything that you prefer, but doing it daily just because it's important to improve balance and it doesn't happen overnight. So picking one exercise every day and, changing it, like I know every day, if you're going to do like chair, it's going to get boring. So maybe changing it up. So, it's nice and you like it and you're doing it. And for importance for balance training, make sure you have something to hold on to. So it's either the wall or it's a nice sturdy chair, not the ones I think that you can foldable because those are not too sturdy. So a nice, chair that's actually sturdy and something to hold on to in case you do lose your balance and you need something to, hold on to. So moving on to weight-bearing aerobic physical activity. So this is very beneficial for your bones and muscles because it works against gravity. So we like to think of it like going on for a walk. And I know 30 minutes is very recommended, but we don't have to do 30 minutes all in one go. So you can space it out 10 minutes after breakfast, 10 minutes after lunch, and 10 minutes after dinner. But it's important to try to get at least some moderate exercise or to vigorous every day. And if you can't do it every day, then try to do something different. Like it can be, if you can't go out, like today it's raining. I don't know how it is there, but it's raining here. And if you can't go out, then maybe like taking on something like a light step activity or even like dancing. So that's also good. And during the summer, I know like biking and everything, it's not that bad. But during the winter, I know it's really cold and you don't want to go out. So in those instances, trying to doing like a step, step on maybe on a mat, just on the spot too. And I know there's a lot of nice videos out there that kind of have like 5,000 steps a day and stuff like that. And that's like 15 to 20 minutes. So if you can do some of those, that would be nice too. So bone health precautions. So avoid movements that involve rapid, repetitive, or weighted or end range forward bending or twisting of the spine. So generally what that means is make sure you're not, you move right away. Even if you need to turn around, just gently do so because you are, when you suddenly move, you might be at a risk of losing balance and falling, and avoid lifting anything from the floor. So, or lowering to the floor. So if like you aren't able to hold something, just make sure you don't try to lift it or do anything, because if you do lose balance, then you are more at risk of, any spine fractures or even slipping and falling. So Too Fit to Fracture is actually a series with Osteoporosis Canada, and it's a series of exercises recommended for people with osteoporosis or spine fractures. So those that already have osteoporosis and spine fractures, these are more like geared towards them and more gentle exercises that are fit their their regime. So moving on to preventing falls and broken bones. So falling is serious, and as we do get older, we are more likely to fall. For people over 65, 30% of falls occur each year, and the numbers are higher for those above age 80. And not all falls do result in an injury, but some of them do. So falls can be very serious and they can be very devastating. So it's important to make sure that we are, taking the necessary precautions. And injuries include hip fractures, head and brain injuries, sprained or broken wrists and ankles. And injuries from falls are one of the leading causes of admittance into nursing homes. And in addition to the financial cost of hospitalization, the loss of independence can definitely be very devastating. So it's important to make sure that you are preventing all these things by taking the necessary precautions and also getting your bone mineral density test done as well. So with the fall cycle, what happens is and I know a lot of people do have the fear of falling after a certain age. And what happens is that fear kind of leads to decreased activity. And as I mentioned earlier, and we talked about, it's important to have daily activity to improve bone mass and bone density. So this decreased activity actually leads to the loss of strength and mobility. So when you don't use your muscles or your bones for a while, you do lose that strength and mobility, which actually increases the risk of falling. So it's important to identify where in the cycle you are to break past it and kind of work towards, doing regimes or practices that are beneficial and you are more comfortable in, and you don't have that fear of falling. So fall prevention and staying independent. So first, it's important to have your vision and hearing checked regularly, just because if you are not able to, see it like something in the way and you kind of step past it, or make sure if you do wear glasses to wear them so you don't trip and fall. And two, it's important to have your medications reviewed. And like we talked about supplements, it's important to get an annual blood test so you know if you need to take certain supplements or if you don't need to. And three, for blood pressure checked. So with blood pressure, if you do need to take medication for blood pressure, taking that, and if you don't check your blood pressure, people do faint, and if you do fall and have fractures that way, that can also be another risk. And four is taking better care of feet and reviewing footwear. This doesn't necessarily mean just when you are going and doing your exercise, but even in your homes, if you prefer to wear, indoor shoes or something that holds more grip, taking the necessary, guidance to wear proper footwear. And five, participating in regular exercise programs, which includes balance training or balance exercises. So with all the exercises we've talked about, balance is important and balance exercises are important. So to have a regular exercise program, it can be a community-based, it can be just among, those you live nearby. You can all gather around and have like a day where you want to do pick different activities. Anything that is more comfortable and you like, make sure you like them, and it doesn't have to be like, oh, I have to do it, but something you like and you can do it daily And if those days you aren't able to go outside and do your outdoor activities, being able to, adapting and doing them indoors. And 6, eating a well-balanced diet and staying hydrated. I know we talked a lot about diet, but hydration is also key. So making sure you have all the necessary nutrients and minerals. And if you are recommended to take any calcium or vitamin D supplement, you make sure you take that on a regular basis as well. And 7, reviewing home for safety hazards. So I also mentioned when we're talking about exercise to have it clutter-free, but this should not just be for exercises, but in general, making sure you aren't putting yourself in a situation where you might trip over something when you're not noticing it. So anything that's in the way, like any box or anything, moving that out of the way. And 8 is learning more about equipment for home and independence. So any equipment you might need or to use on a regular basis, making sure that you are using it appropriately. And if you need something to help, like to walk and move around, making sure you use that adequately. And 9 is any other questions you may have to speak with your healthcare provider. And this might be on an individual basis because they know, your every of your health conditions and anything that you might require and any other medications you are taking. So if one is impeding the other, you kind of speak to them about it and ask them how you can, how you can integrate taking supplements and also all these medications in one day. And if you have any questions, you can reach out to Kathy. This is her email address and this is her phone number. So if you have any questions, this is our community engagement coordinator. And this is Sandy, and she's also our community engagement coordinator for the region of Saskatchewan and Manitoba. And you can also reach out to her, and this is her contact information as well. And there are some online resources. So when you do go onto our website, there's the Know Your Risk Assessment tool. So it asks a bunch of questions to notice your risk. There's a calcium calculator. And there's also a brochure and fact sheets, so specific to like nutrition and exercise. And we have Unbreakable e-newsletters where they you sign up and they'll send you like newsletters on every different aspect of osteoporosis and any new work we do. And there's also the Canadian Osteoporosis Patient Network, which is COPN, which you can also use. And if you do use any, any social media, make sure you follow us. And I'm sure they'll update you on our, regular basis with anything, new information and anything you find. But thank you so much for listening and, coming out today. If you have any questions, you can drop them in the chat. I see there are some. And if you want to unmute yourselves, you can unmute as well. Okay. So is there any danger?
Thanks, Kajina. Thanks so much for the presentation. That was amazing. Such good information. Such good information.
It's a lot of information to take. I usually don't provide the our slides because they do change regularly. But if you guys have any particular questions, or you want more information, it is on our site. And if you need something, I'm sure Kathy can send it to you as well, Meg, and you can pass it on.
Yeah, no, someone asked if you could put the slide of Kathy's information again.
Oh, sure. Okay. Yeah, no.
And then we'll tackle some questions. I see we've got some great questions. And if you have any more, feel free to pop them in the chat. All right, Kajina, let me know when you're ready. I've got our first question here. The first question is there any danger in having too many bone density tests? This individual is part of a longitudinal study on aging, and a bone density test is part of that assessment, but no detailed report is provided. She has osteopenia and would like the doctor to book a separate test, but he's reluctant to do this. What do you suggest?
So a longitudinal and osteopenia would like to. I think you should ask them why he's reluctant and ask him if there's anything that, I'm not sure the medications you're taking and anything with the longitudinal study that you're part of, and why he's reluctant. So I'd say speak to him, like, ask him directly, well, why should I not do this? Is there something part of the longitudinal study that I shouldn't be, part of doing, or that should not allow me to do another bone mineral density test? But I think you should ask, how often? Is it just one bone mineral density test they do? Not sure. Is it? Because
okay, well, why don't we move on to...
We'll move on. Yes, if you can unmute yourself after, and you can.
All right, why don't we move on to the next one? I became lactose intolerant in my 30s. Did this contribute to my diagnosis of osteoporosis?
Good question. I know a lot, nowadays, everyone's lactose sensitive. Well, calcium is through a lot of, milk and cheese and all that stuff, but there are other alternatives. And if after your 30s, if you did start taking supplements, I'm not sure if that's related or correlated to that, but I think supplements would help with it, but I can't tell you if that's fully contributing to your diagnosis, because there's a lot of factors, and believe it or not, menopause and all that stuff also play a role. So I think there's no one clear-cut answer to why people get diagnosed with osteoporosis, but because you became lactose intolerant, maybe you did cut out a lot of important, essential calcium that you needed. So maybe now, I know you are diagnosed with it, so maybe now taking calcium on a regular basis would be more beneficial. Hope that answered your question.
Awesome. The next one is, how do you manage osteopenia?
Good question. I don't know if that's my expertise, but it is a loss of bone mineral density. So I'd say the same way you'd manage anything that's related to osteoporosis, but the medication may differ. So I'd say you should speak to your healthcare provider with anything in specific, because these are all general guidelines, and I know we don't have to follow it, but each individual person does have, they have differences in their the medication they take. So it's important to kind of speak with your healthcare provider for that. Yeah.
I see someone else asked about, says my doctor advised to discontinue calcium supplements and to get it from food. How do I know to get enough? So based on what Kajina shared, I'd recommend visiting the Osteoporosis Canada website, where you can use the calculator. I think that's such a great tool. I'm going to check that out too. That's awesome. All right, just got time for a few more. Should someone with osteoporosis avoid coffee? Also a good question.
That's a good question. So caffeine does draw out some of the minerals in your body. So if you do have osteoporosis, it's best to limit it, to maybe not drink too much, because caffeine does draw a lot of that. I learned that 2 months ago, actually. Someone asked the same question. So you don't have to completely cut it, because I know it's hard to just say, oh, don't have it at all, but maybe having it in a reduced portion, or maybe limiting the intake down to having to 2 cups, maybe 1 cup a day. But it's more about, not with osteoporosis, more about the nutrients. So it's not even your bone structure, it's more about what coffee does to some of the nutrients that we need in our body. It kind of takes it with urine. So that's why it's important to kind of not fully avoid it, but maybe have a reduced portion. If you are taking medication, I think it's fine, but maybe have a reduced portion or a reduced cup intake of caffeine.
That's good advice. Can medication side effects be more important than the risk of fracture?
No, so the risk of fracture, if you're going to look at, it depends on the medication you're taking and the dose. If you don't take the medication, then you are at an increased risk for fracture, which means there are other factors. If you have a fracture once, you are prone to another fracture, and fractures do take longer to heal. And depending on the side effects, I think it outweighs. So I think the side effects, taking the medication outweighs the risk or the side effects of the medication overall. But it also depends on the type of medication and how long you're taking. So I know a lot of these things, like a lot of studies haven't been done on it's not longitudinal. I know someone's part of a longitudinal study. It hasn't been done over time. It's more about is it improving it in the short run? Is it helping a person, heal better, or their bone density, is it getting better? So a lot of the studies aren't, longitudinal to say if it does have a, and a foreseeable side effect. Let's put it that way.
Mm-hmm. Here's another one. Is a weighted vest a good idea as an exercise option?
A weighted
vest. So I guess like wearing a weighted vest.
As well, you can do any weight bearing activity. So if you do have a weighted vest, it is adding to it, but you should be able to balance with it, because if you do, I know they don't increase. I'm not sure if it increases by 5, 10. If you just put on a, like a 20, 30 pound weighted vest all at once and try to do something and you lose your balance, that's not good. So maybe trying to start off with something small and then moving up to, a weighted vest. Like if you're doing lunges, maybe starting off with your own body weight and trying to see if you're able to balance and do that for longer, and then moving on towards it. But don't go to that right away, because I think I am sure Meg would say it's not a good I think way, even, and not even balance, but also your muscles need to get used to it. You need to condition them. So you should want to get that started with lighter exercises first and then moving on.
Mm-hmm. Yeah, that's what I would recommend too. And especially if you do have osteoporosis already and have a weak spine, then that might, because like Kajina said, you can have a fragility fracture. So if you have too much weight as you're exercising, it could actually be too harmful. So I would also suggest start exercising without, and get really good benefits just using weights. All right, well, we've got a few more questions, but we're running out of time. So if you do want to reach out to Osteoporosis Canada or check out their website, I am told here by Antoine that we're going to send out the links in the recording as well. So that will be a really good place to get more questions answered, and a really good resource as well. So Kajina, I want to thank you so much.
I wanted to add to the caffeine question. So the particular nutrient mineral that happens is from caffeine actually draws out calcium from our bones. So if you're not getting enough calcium to begin with, it is drawing it through urine. It doesn't do it in great amounts. It's very little, but obviously over time it's not noticeable. So if you're taking calcium supplements, maybe your doctor might even advise you not to have caffeine, but it all depends on your individual circumstances and how important it is. But it does draw, caffeine does have that tendency to draw calcium out of your bones. But yeah, sorry, just thought I'd add that in there as well.
Yeah, no, thanks for adding that. That's really good. Great questions. Awesome. Thank you so much.
Thank you.
Wonderful. Well, thank you very much, Meg and Kajina, for this terrific presentation. Whoops, there's my camera over there. I want to just remind everybody that we're going to send you that follow-up email that will have the important information on how to access the recording of today's webinar, and also information about our speakers and how you can get in touch with them. And we really, really hope you're going to decide to participate in the mega recruitment campaign to help refer new members to us. We need your help to grow it, and so that we can continue to offer terrific webinars and experiences to our members. And don't forget, you can invite non-members as guests to come and be involved in these webinars, and that way they can get an understanding of the kind of work that we're doing for our members. If you want to look at what's coming next, please go to our website. That's where we have the upcoming webinars listed. We have one coming very soon on November 2nd. We've got Rob Carrick from the Globe and Mail, the personal finance columnist. He's actually going to talk about weathering stock market volatilities and other financial challenges ahead. And we're actually going to make this into a national event. It's going to be offered all across Canada. So it's our branch working very hard, not just to help our own members, but working with the national office to help all retirees across Canada. So November 2nd, Rob Carrick. Anyway, thank you again, and we hope to see you at our next webinar. Merci beaucoup tout le monde et au revoir.